Everyone has experienced anxiety at some point. We may feel anxious before an exam, before a job interview, when we have to pay bills, and even when interacting with others. In general, anxiety is normal. Except if this anxiety does not subside, and occurs without a clear reason. So when does anxiety turn into something more? At one point does it become a serious illness? To answer this question, let's take a look at this video. Before we begin, please do not self-diagnose yourself. If you or someone you know experience symptoms of mental illness or distress, please contact a professional psychologist or psychiatrist. First, we must distinguish between anxiety and fear. Imagine that fear is the feeling you get when you're in a fight. Anxiety, then, is the feeling you get before the fight. Fear is evoked by a clear threat that you can see. Anxiety, however, is summoned by thoughts of things that could happen, such as threats and situations that you may face in the future. The brain houses two parts that play a big role in triggering feelings of anxiety. These are the amygdala and prefrontal cortex. Think of the amygdala and prefrontal cortex as two lighthouse keepers. The amygdala monitors impending threats, while the prefrontal cortex will confirm whether the threat is real or not. For some people, however, these parts of the brain don't function well. The amygdala may be too sensitive, and may see threats everywhere. In addition, the prefrontal cortex may be ineffective in determining how real a threat is. These changes in the brain are what cause a number of anxiety disorders. There are actually several mental disorders that fall under the term anxiety disorder. PTSD and OCD used to be included in this category, but since the release of the DSM-5, they are now in a category of their own. For this video, we will only discuss generalized anxiety disorder, GAD. So what exactly is the difference between normal anxiety and GAD? For people with generalized anxiety disorder, GAD, the anxiety they experience must appear consistently for at least 6 months. The anxiety will be very difficult to control and is accompanied by other symptoms, such as difficulty sleeping, muscle pain, and abdominal pain. The biggest differentiating factor is that the anxiety experienced by people with GAD must be excessive. This means that perceived threats are either non-existent, or a disproportionately lower threat, in contrast to the excessive amount of anxiety felt. Humans are complex social beings and can perceive many things as threats. Take for instance, social media. Social media has increased the amount of GAD cases, especially now. Humans have always been concerned about people's views towards them. This makes sense. As for our prehistoric ancestors, removed from a group can cause death. But now, social media has made anxiety worse. We may often feel alone, isolated, or even embarrassed. And for people with GAD, these feelings can become too difficult to control. Please remember that people with anxiety disorders are not to blame. Just imagine seeing someone with a disability and saying, "What are you doing in a wheelchair? Why don't you just walk?" People living with anxiety disorders experience real emotions and feelings that cannot simply be ignored. Therefore, instead of making them sink deeper into a sea of anxiety, it's better if we give validation and support, so that we can make the world a little less anxious. That's it for this video. If you or someone you know needs mental health services, please contact a professional psychologist or psychiatrist. Don't forget to like, share and subscribe, so you don't miss any of our new videos. If there is a topic you want us to discuss, you can also write it in the comments section. You can see the links to the sources we used in the description section.